Of Ian is a Weirdo or Ian is Weird, depending on where you're watching this. I am streaming on both of my channels because I feel like this is something that is important to share with people and has really got me kind of messed up in the head, more so than usual. So I experienced some pretty poor healthcare based around my gender identity today. And for me, it's really important to share this experience for other trans folks, other um, or just people who are under the trans umbrella, but also for people who support others who are in the trans community. Um, I am going to give a little background as to previous care that I've had that has not been great. And I'm going to share what happened today that kind of compounded on everything else I've experienced recently. And for me, this is really important because I think that, obviously, healthcare has a long way to go in a lot of capacities. But for me, this was a little bit of the straw that broke my back, which it didn't take much because I was already in a pretty hard place with getting care for my gender dysphoria, right? So some background on me and a situation I dealt with earlier this month and late last year. So first of all, I am a trans man. I was on hormones and my prescription ran out, trying to get that refilled, and that's where this whole new problem got set up. And then I have surgeries planned, and I'm talking to doctors about surgeries that I want. If you are anti-trans healthcare, anti-trans and gender-affirming surgeries, I really don't want to hear it, and I will not hesitate to be like, fuck off, because I'm just in that place right now where I don't need anyone who doesn't understand the intricacies of trans medicine to tell me that this wasn't a big deal or this was actually a good thing, because I shouldn't be able to do and control things that happen to my body while I am a consenting adult. So we're not going to play that game today. I'm not in the mood. I'm not going to be educating trolls on why they're wrong. So just a heads up, that's what's going on today. So if I seem like I am in a foul mood and I have low patience, that is exactly what is going on. So a little history of recent medical care that was kind of a issue. So I went to a hospital close to me at the end of last year. I think it was maybe the 28th or 29th of December. And I was having extreme pain in my abdomen area. And I decided to go to the emergency room. I'm not someone who takes emergency care lightly because I know it's very expensive, but for me, that seemed like the proper option for what I had to go through. So I keep on dinging my cup of hot cocoa. I needed hot cocoa for my soul today. I'm not a huge hot cocoa drinker, but today I needed it. So I was having extreme pain. I went to a hospital system that I've been to before, and it's been okay, but I don't believe I've been since I've been out as a trans person. And this place was constantly misgendering me, calling me by my dead name. And even when I corrected doctors and nurses about my pronouns and my name, they would consistently call me the wrong name and misgender me, not only to other practitioners, but directly to my face. And even when I was correcting them, and I try not to be like, if one person makes, a little error, I try to give people the benefit of the doubt. For me, it's important that like I try to be understanding that maybe like it wasn't in the chart, maybe it wasn't in the notes, something like that. But this particular hospital didn't have a place. They had like uh, they had my gender identity in the chart as transgender male, and but they didn't have any spot in their system to put my preferred name or my preferred pronouns. And so there wasn't really any way that like a provider could come to me for the first time and be like, hey, we're going to call you the right thing. So it wasn't necessarily the provider's fault at the beginning, right? But once you're corrected, you need to roll with that, right? So I had an emergency gallbladder removal at the end of last year, and I ended up having some complications with that a couple days later. So at the beginning of the new year, I had to go back to the ER for complications from my surgery. And this is not related to, the surgery was not related to anything regarding my trans identity, but I was constantly misgendered, constantly, like no one would listen at all to what I was telling them. And that was a really challenging experience that I tried to be more, I just, it was just really challenging, right? So I, have been on testosterone for, I believe, almost 3 years now, and it is part of my gender-affirming care. I know not every trans person goes on hormone replacement therapy. For me, it was very important in my gender dysphoria to be able to go in and get called the right name and get called the right pronouns, right? And I think for some people who are not in the trans community, they might have a difficult time understanding how difficult that could be. Um, and I don't really know how to explain it to someone who hasn't experienced gender dysphoria, if I'm being honest. So it's kind of like, I don't know. It's very difficult to find anything that's relatable for folks that don't experience this. Now, so I ran out of testosterone in the middle of December, and I tried to get an appointment with my former care provider that prescribed the medicine, and because that's what it is. It's not cosmetic. It's covered by insurance. It's seen as a legitimate physical health problem. For those of you who don't know, gender dysphoria is not a classification in mental health. It is a classification in physical medicine. And I need that to be clear, because if anyone's like, hey, you're mentally ill because, I mean, I am mentally ill, but it doesn't have anything to do with me being trans. But if anyone tries to come in and be like, oh, like, you're just mentally ill because you're trans, like, that's not the current understanding in modern medicine of how gender dysphoria should be treated. Now, so I needed to get back on testosterone, but they were like, well, your provider that originally prescribed you this medication is no longer with the practice. Okay, that happens a lot, right? You're with a doctor and they leave the practice. You have to start seeing a new doctor, blah, 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 whatever. So this location, so I'm located in North Carolina in the United States. And like, don't think for a second that because I'm talking about trans health needing to be improved, that I don't think that there are many other places that healthcare needs to be improved. That's a story for another time, right? But for this, I needed a doctor that prescribed me my hormone replacement therapy. So this practice has multiple locations in the area that I live. The place that I went before with the doctor who prescribed me my medicine, they are located about 45 minutes away. And this system also has a practice that is like 5 minutes away from me. So I was like, hey, does this other location provide gender affirming care? And I was told explicitly that this uh, this um, this practice was able to accommodate those needs, right? So so I and so generally, in my experience, when you need hormone replacement therapy, you have gone to see an endocrinologist who can help you with that. Endocrinology is a specialty. It's harder to get into, especially for first-time care. Um, so this past experience I had, it was with a family medicine doctor, which is cheaper generally than a specialist, right? Primary care physicians are cheaper. And so I was like, oh, some primary care physicians can handle gender affirming medicine. So again, I was told that this place, 5 minutes away from me, could handle that. So it was like, great. And then I scheduled an appointment through the app that this hospital system has. Now, when I went and had my gallbladder surgery, this was a facility that I didn't know how well they would handle trans healthcare, and they handled it pretty poorly. So, but I know that the practice that handled my testosterone before, that hospital system, I know and have been told by multiple resources that all people, not just doctors, not physician's assistants, not just nurses, but even front desk people were told how to handle gender affirming care and how to properly address people. So I know that this wasn't just like the whole hospital system wasn't educated. In fact, I was told that the whole hospital um, system was able to accommodate those needs. My pronouns are in the system. My preferred name is in the system. Um, and uh, so I went in today. When I scheduled the appointment on the app, I specifically said this is for medication management. In the notes, I am specifically looking for someone who can re-prescribe my testosterone. My prescription is out, and I need a letter of support. Now, for those of you who don't know, whenever you are receiving gender-affirming surgeries, they generally require a certain number of letters of support. Letters of support are from medical and psychological professionals that will say, hey, this person is okay to get surgeries, gender affirming surgeries. They do have gender dysphoria, and I believe that their lives would be improved by having these surgeries, right? So I put in the notes, this is what I need. They scheduled the appointment, so you've put in a request for an appointment, and then it is approved or not approved, right? So this particular request was approved, and I was scheduled with a doctor today. And I put this request in a couple weeks ago, and there was no problem, no communication to me that this would be a problem, and so I went in today, was kind of misgendered quite a few times right off the bat, tried to shrug that off. I was like, okay, maybe this office staff just is kind of not doing great today, and tried to give people the benefit of the doubt. As I said, that's my preferred method, is to try to give people the benefit of the doubt if I get misgendered. Now, or, called my dead name. But then I go into the I guess I don't know if it's called an operatory in medical, but like I go into the room after they take my vitals and stuff like that, and talking to the nurse. The nurse is, fine, I guess. No real problems with the nurse. I told her what I was there for. She did not say anything like, hey, this is not um, what you need. Also, I was like, they asked at the front desk if I wanted a physical, and I was like, not really right now. I just need to get my medicine. That's my main priority right now. So the doctor came in um, and was like, okay, what are you here for today? And I said, this is specifically what I need. I need a medication refill. And the doctor was like, I don't do that. So I kind of started getting into a little bit of a panic state. For those of you who don't know about my mental health, I have multiple mental health diagnoses. I have bipolar, I have borderline, I have anxiety, I have PTSD. Just a lot of things that make me very nervous, make me very on edge, affect my mood, and overall mental health. So, but one thing that I did, okay, so this person was like, I don't do that, blah, 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 blah. And I just started to kind of like freak out, and it's just like, okay, well, I came here and I waited for this appointment, and they're like, you should see an endocrinologist. And I was like, I know that that's the optimal solution, but getting in for a new patient for an endocrinologist generally takes about, hey, Crystal, generally takes about 3 months to get in, and I'm already a month and a half out from taking my last dose of testosterone. So I can't really afford to go 5 months without testosterone. For those of you who don't know, dips in testosterone levels can affect your mood. You can be more depressed. All of that stuff. Cisgender men experience this with low T, and also people with gender dysphoria who are on the medicine, right? So, I've been, and then I've had some big changes in my life with the surgery and all that stuff. So this practitioner was pretty adamant that regardless of how necessary I thought it would be to get this care, that they could not provide it. Which I'm not asking anyone to prescribe or do anything that they're not comfortable with doing. But the issue is that I was told by multiple resources, and I scheduled the appointment clearly stating that this is what I was there for. So I was like, why the fuck am I here? And then they started asking a bunch of questions about my mental health. And I answered them as honestly as I could, because I do find that it's very important for me to communicate with my providers the experience that I'm having. And but how they asked the questions, they kind of did that thing where they asked 10 questions at once. Do you have any thoughts about self-harm or ending your life and all this stuff? But they ask like 10 questions at once, right? And so if I say yes, which one of those questions I needed to say yes to, and they were like, well, we recommend you go to the hospital. And I'm like, no. Because you asked really vague questions. You aren't very informed about my mental health, clearly, because you asked like a fucking billion questions at once. And I had to clarify a bunch of questions that they asked because they just were so confusing and vague. I've never had this level of like like, here's the thing about me. If I need to go to the hospital for emergency mental health care, I will. I'm the type of person that I will go. But I also have been to the hospital, been to different providers and different care systems where I know what I need when I need it. And if I'm feeling a certain type of way, I know where to get help, right? So I'm not a newbie to mental health care. I am a professional at this point. So they were like, well, we recommend you go to the hospital. Well, you ask vague ass questions. You don't know that I actually need the hospital. You just know that I have had some thoughts about self harm and suicidal ideations, not plans, but ideations, right? Just thinking about it. And, but because of the way you asked it, it makes it seem like I'm actively planning to do something, which is that's when you should go to the hospital. Not if you have thoughts like, man, life is pointless. That's not a hospital issue, right? And if you go there, they will literally be like, you don't really have to do that. So the questions were framed, I believe, in like a very it was almost like we need to, so I don't know how to phrase it. I didn't feel like they were leading questions, if that's kind of what you're getting at. It was more like, hey, because you scored high on the PHQ, which is the patient health questionnaire, which is about let's see, it has a lot to do with like self harm and SI and stuff like that. I scored high on that. I always score high on that. You all know me. This is my life, right? So I scored high on that, and then there also is a general anxiety question, or GAD. I think it's GAD 7. I don't know, but basically that talks about your anxiety levels. I have multiple anxiety disorders, so I score high on that as well. So their questions are trying to find out generally if I need a higher level of care. I understand that. I respect that. But the way that they asked the questions, it was almost like um, we just need to kind of confirm that you're not going to hurt yourself. But the way that they asked the questions, it was almost like, here's just like a check on your chart whether or not you need that level of care. It wasn't personal. There was no empathy behind it. Like even if I was just looking for a family, thank you for coming in, Mama G dear. For me, I found I've never experienced this level of like almost insensitivity. Yeah, they need to be more up to date on their training in multiple senses. Um, but so the way that they were asking the questions was just really confusing for me. And when you have ADHD, getting asked these multiple point questions is very, very difficult. I think they're difficult for everyone, but especially with ADHD, because when they ask you 10 questions, if you hear one that you identify with, you answer yes to. um, Thank you very much. I really appreciate that. I just need some virtual hugs. And I'm kind of just venting, but like also just kind of making a point that healthcare, especially, trans healthcare and mental health care need to be better. I know, like I said earlier, I know that there are many more flaws in the US healthcare system, so I'm not trying to ignore those flaws, but I'm just describing my experience today. So, this person was like, go see an endocrinologist, and I was like, that takes too long. I'm gonna be off T too long. I don't feel comfortable with this, And the thing about gender affirming care is that it's considered, and it truly is a life saving form of healthcare. These are not optional things for people who want or need that level of care. They are necessary and they are considered life-saving. So to deny someone that, to have so many levels of failure across this one practice, is just pretty ridiculous. Yeah, barbaric is the word. I would say barbaric and antiquated, both of those. And so I told this person, I told this doctor, I was like, I do not need to go to the hospital. I was like, I'm not trying to be defiant or tell you that I don't need it when I do. I'm just telling you that I've been through the mental health care system enough to know when I need that level of care, and I don't right now. So I'm pretty sure I have a very high suspicion, with reasonable cause that they put in my chart, that they recommended that I uh, go to a hospital for my uh, mental health, and I refused, when the fact is I did not need that level of care. They did not trust me. They asked confusing questions, and they probably have in my chart that I just refused to go get care. So this is a big problem, right? And this involves both mental health and trans care and gender affirming care, because so I am scheduled literally 1 month from today. I have my pre-op for my top surgery, and a month from that, you slightly question the doctor holding while it's a pompous area. Exactly. It's like the thing is, and there are some doctors who are very aware that the patient knows what they're experiencing better than the doctor. The doctor is just there to kind of put the pieces together and see how they can help, right? But there are some doctors who come into the room, assume they know what they're talking, assume that they know everything, what you're going to say, how you're going to react, whatever. And they don't really listen to what the patient's experience is like. And I do not feel like this person considered my experience at all. So, and if you view, we are our best doctors, absolutely. And I think that there's a balance, right? I think that, self-diagnosis, looking on the internet for solutions and stuff like that, you have to balance that with going to a doctor. I feel like it's good to educate yourself, but I feel like it's also important to get professional help. So there's a balance, right? And so the thing is, my top surgeon, my plastic surgeon for top surgery, will not take you, if you have been to the hospital for suicidal ideations within 12 months of the pre op. And I think I have a note in my chart now that I should have gone and I didn't go. And I don't know if you all recall, I talked about this last September-ish. I had an appointment I had my pre-op, and literally 1 week before my pre-op, they're like, "Oh, you went to the hospital in February, and therefore we can't do it." And they just canceled it on me. They didn't give me a chance to explain. They didn't give me a chance to talk about it. They just cut me off. It was very abrupt. I've received feedback from that same office, but a different provider, that the whole, like, everyone in that office was like, what you all did, the doctor and the scheduler, and the nurse said, hey, what you did was fucked up. So it was very validating to me to hear that people thought it was fucked up, because I felt like it was very fucked up, and I just went into a tailspin, a mental health tailspin, right? So this person's like, go to an endocrinologist, and I was like, do you fucking know how long it takes to get in to see an endocrinologist? And I, they just, like, they weren't listening. And that's the thing. It's like, when you go in, a doctor needs to listen to you and your experience. So all the while, these people are calling me the wrong name, are misgendering me, not only to other practitioners and schedulers, but also directly to my face. And so then, because I was like, I am here specifically for this reason, right? And then they I had said, I don't really feel like I need a physical today because I'm just here for one reason. And so the doctor was going to do a physical on me, even though I came for a specific reason and that doctor could not accommodate it. And so, and also okay, I forgot to mention that I had a little breakdown in the office and just started weeping. I've been weeping a lot lately, but I just was like, you're not even trying to help me. You're not seeing things from my point of view. You're not trying to see things from my point of view. And I'm very frustrated because you are showing zero empathy, which I feel, from my experience, like growing up, my mom is a dentist, still is a practicing dentist. And my mom is a great dentist and shows so much empathy towards her patients. And so to deal with medical professionals who show very little empathy for their patients is really like borderline foreign to me. And I don't think I experienced that until I had either severe mental health issues or I identified as trans and tried to communicate that to my professionals. So, misgendered directly to my face. I'm there for testosterone. My name is Ian. My pronouns are he, him. And you continue to call me by my dead name and misgender me, even when I correct you. And like I said before, I try not to correct people, overcorrect people, because people make mistakes, right? And like people are human. That's okay. But if I correct you and you continue down that path, you've shown me that what I said to you does not matter. Um, so so I'm in the South. Just want to put that out there. I'm in North Carolina. So I know that my state has a much longer way to go than other places in the United States. Um, Even though those places still have problems, I feel like being in the South, it's a little bit amplified due to the nature of being in the Bible Belt, right? So just was almost exclusively misgendered. I don't think I was gendered correctly once. Some people did use my chosen name, but that's it. Um, and so I went, and so then she was like, "Oh, well, I can do your physical now. If you want to hop up on the bed." I was like, "I just want to make it clear that I am not paying for this visit. You have offered me none of the care that I asked for, and you're trying to offer me care that I did not ask for." I was like, "I just want to be clear that I'm not paying for this visit. I do not want a physical. I want to get out of here because I'm not receiving the support and the care that I need." I was very clear, and I was over it. And so once I started breaking down, then like a shred of empathy came out, and and uh, she was like, "Okay, well, we can try to call the old office that you went to, and even though that doctor's not there, we can see if they have providers there that can do gender affirming care and all of this stuff. And we'll call them for you. We don't want to put that pressure on you." So there was a complete change in tune once I started crying. And no person should have to get to the point of tears and a mental breakdown for you to give a shit. I'm sorry, but like that shows that like you just fucking suck. you know? So so I had to have a breakdown literally for them to give a shit and try to support me. So they were like, "Hey, we're going to so first the doctor was like, I'll walk you to the waiting room. We're gonna call these people and see what we can do for you, right?" And so it's like, okay. I tried to compose myself a little bit, but obviously I was still very upset. Then while we're in the hallway, my doctor meets someone, I don't know who, and was like, "Hey, this is my patient. They need some gender affirming care, blah, blah, blah." Told them the situation, and then proceeded to misgender me to my face and to this other professional. What? So it was like, this is not a time to correct because clearly this person lacks a lot of empathy and doesn't listen to their patients. So I just was like, okay, gonna stomach that one. And then, so I sat in the waiting room, and this is a very large waiting room. Not quite like ER size, maybe like 50% of the average ER waiting room in my area, right? And so I sat in the waiting room for like 5 minutes. They told me it would be like 5-10 minutes to get a hold of this practice, and then they were going to try to get me some care, right? Or find some providers. So they came out in the waiting room. They're telling me all this stuff, like, sorry you experienced that. The clinical manager came out and was like, I'm so sorry for your experience. And I was like, hey, again, to be clear, I'm not paying for this. You were giving me a refund on my copay because you did not provide care. Like, yeah, you asked me questions, but like literally anybody can do that. So I don't like that's not providing care. You went through a script of asking questions, basically. But they gave me a phone number. But here's the thing: I'm having a crisis. I have calmed down, but I'm still very visibly and emotionally upset. And there's a waiting room, and there's probably 20 other people in the waiting room, and they decide to have this conversation with me in the waiting room where other people can hear. And that's not the worst of it, but like this should not have been performed in a way that exposed my private information to other people, right? But I just was like, that was like low on the totem pole for me. I don't give a shit if anyone knows I'm trans. But like for some people, that's just not. They created that crisis exactly, and no one wanted to take responsibility for it. But like, someone has to, right? Because someone made a mistake, and they tried to pin it on me in some senses, like, oh, I should have done more research. I did as much research as I possibly could with the resources I had. So they gave me the number. Yeah, HIPAA violation, right? Like they should have not had that conversation with me there. So they gave me the number of the practice that I went to before. Again, it's 45 minutes away instead of 5 minutes away, but I was told that the place that was 5 minutes away could provide gender-affirming care, which is why I went. And it's more convenient for me. It's easier on my agoraphobia. So HIPAA is basically a privacy prevention act, where I believe it's Health Information Privacy Protection Act. And they like legally cannot expose your medical information to anyone that you do not give explicit access to. And that's kind of like mainly the thing, right? Is like your medical information is private, and you get to decide how it is dispersed and who it is dispersed to. And so, yes, HIPAA violation right there. And so they gave me the number to call. It was the old practice that's 45 minutes away, but they said they called, they verified that there were professionals there that could help me with gender-affirming care and things like that. They're like, oh, well, if your old doctor left who could do this, they probably replaced him with someone who could do the same thing. And I'm like, that's not how any of this works. I don't know what you're talking about. Like that's not 100% of the time, right? So anyways, I went to the checkout counter. After they gave me all this information, I talked to the clinical director, and I was like, I'm not paying for this. I did not receive care. And told her the whole story and everything like that. Again, all of this is out in the waiting room. There are at least 3, 4, 5 people in the vicinity that can hear what I'm going through. Also, I was very distracted because she had very bad eyebrows, but that's not the point. But anyways, so I went to the checkout desk, and because I told the clinical director that I wasn't paying for it, and I was like, can I go directly to the checkout desk and tell them that I'm not paying for this visit and I need a refund? And she was like, absolutely, you can go there. They know what's going on. That'll be fine. And so, okay, so the clinical director and the nurse that helped me go back in the back, and I walk up to the checkout desk, and I was like, hey, I just spoke to the clinical director. I will not be paying for this visit, and I would like a refund because I did not receive care. And I know I'm saying the same terms over and over and over again, but that's how it had to be so that I was consistent when everyone behind the curtain was not consistent. So I had to be consistent because they couldn't handle that level of consistency, right? So I went up to this desk and I said that was what was happening. This particular associate did not know how to do a refund, and I was like, okay. And then so they brought someone over. Yeah, I had to advocate for myself, and I'm already in a state of mental health semi-crisis. So this is a very hard thing for me to do, but I had to do it. So I had to just pull myself up on my bootstraps and fucking try to advocate for myself. And so I went and I spoke to this person. They brought someone else over here, and they will not stop misgendering me. They misgender me like rapid fire misgender me. She, her, she, her, she, her, all the fucking time. And I said, I am a trans man. My pronouns are he, him. And they said, okay. And then they continued to use she, her. And then I raised my voice just a little bit. I wasn't screaming, but I raised my voice and I was like, I am a man. My pronouns are he, him. Stop saying she, her. They both look at me. Then they continue to misgender me. This goes on for like 5-ish, maybe 10 minutes. I'm furious. I am fuming. And I don't really get this mad when I get misgendered. But they have managed to push every single fucking button I have. This place has just infuriated me. And so I was tired. I was fucking tired. You know what I'm here for. The thing is, like, if people, I have found that if people are cisgender, and I don't know for a fact that they were cisgender, I didn't ask them, but like, if people are cisgender and I gender them correctly, if I start calling someone who appears to be a woman he, him, and man and stuff like that, they don't really care that much. Misgendering generally affects people with just dysphoria so much more than people who are cisgender, right? Because, you know, they're like, okay, whatever. But like when you are experiencing this huge change in your life over years and years and years and years and years, you know, you grow more sensitive to it. And I think that's why a lot of people don't understand why when people are misgendered they get so upset, is because it's very hard to put yourself in those shoes if you have not walked that life, right? So like, it's not like if I just started saying, well, he, him, like, oh, he said this, like, I just don't think that person would care. In my experience alone. But anywho, and like, also, I don't like being misgendered. It's hard for me, so I don't want to put that on anyone else, right? You know, I'm not that kind of person. I will get mad at you if you can't do your job that you were supposed to do and shouldn't be that big of an issue. I will get mad if I try to advocate for myself and you blatantly ignore my requests. that's when I will get mad. But I'm not. I try to again, and I've said it a million times, I try to give people the benefit of the doubt. You say she, her 1 time, 2 times, okay, then I will correct you. If I have corrected you and you continue that, you show me that you don't give a shit. So they continue to misgender me, and I'm like, what are my options here that won't land me in jail? Because I have reached, I don't want to put too much incriminating evidence on the internet, but let's say illegal activities were running through my head for options. And that's all I'll say. But I was shocked at how bad it was. I was shocked, and like I tried to give in like my backstory at the beginning. If you were here, I had a pretty bad experience. I have bail money. Okay, I will keep that in mind. And I can always plead insanity. That's horrible to say. But in my background, I had a pretty bad experience when I got my gallbladder removed. It was a different hospital system that I don't know for a fact what their trans and gender-affirming care experience is. So for me, that was really hard to be constantly misgendered and dead named. So I have that at the beginning of the year, late last year, with my gallbladder surgery. And now I'm in a different hospital system that I've been to that is known for training, doing sensitivity training on gender-affirming care. And I know for a fact that this hospital system has received that care because I've received that information multiple times that they have done specific training on this. So I'm like, where is the fucking disconnect? And so I'm fuming. I'm so upset. I can't believe I called this story time a cascade of failures. It was failure after failure after failure in communication and scheduling appointments in literally every aspect of the care that I should have received. It was all failures. All failures. Everything was wrong. I'm glad that I got my refund. They didn't put up a fight when I tried to get my refund because I've had doctors do that. And I don't know, maybe I've asked for a refund from a doctor maybe 3 times in my life. I don't generally do that, even if they didn't do exactly what I needed. But because this was so bad, I was like, I'm not paying for shit. You can suck it, right? And so I leave the practice. That's pretty much the end of my experience. They did. Yeah, where is the accountability? Nowhere. Nobody gives a shit. Like, I'm pretty sure that these people are going to go home. They're going to forget that this. Yeah, I know. It's really hard because I would have to check the laws. I mean, I think I have a HIPAA case, but to prove that it happened, I have no proof. I have no physical evidence that that's what has happened. So they would have to take accountability for providing my information to several people who were in the waiting room along with me. And I managed to stay as calm as possible. I did have that crying meltdown breakdown thing, but like I did not scream at anyone. I did not throw the fit that was bubbling up inside of me. I tried to because I was like, yeah, I was like, I tried to look on the app and I was like, is there a way that I can provide feedback or like anything? Can I contact anyone and say this was a really bad experience? When I went to the other hospital, I did tell them that they needed to be better. I was like, you need to update your system to be able to provide to have this information because it's important. This is important to people. If people are already in a level of physical or mental distress, and you add to that, you are not doing the what's the credo of medicine, which is do no harm. You are doing more harm, right? You are adding insult to injury. So So this was a bunch of failures all at once. I left. I was so pissed. Hey, Scraptastic Crocheter, welcome in. I'm kind of having a little vent session because I had a really bad experience with a medical provider, which compounded off of another bad experience that I had with, yeah, exactly. And it's like, here's the thing. My medicine level has been documented in that system by, so it's like the hospital system, family medicine. They have multiple locations. So it was just a different location of the same fucking practice. So they should have, like, they, Hippocratic Code. Okay. And, yeah. And so, they literally, it just was like totally, like, they had my dosage. They had a dosage that had worked for me for years. All they had to do was say, okay, we will write you this script. I'm not asking you to find a dosage, to pull a dosage out of your ass. I'm literally telling you what's going on. All you need to do is refill the script. But if people don't feel comfortable doing that, I am fine, literally fine, if that's not something they're comfortable with. So end up in the psych unit. What a nightmare. Honestly, I've been to the psych unit many times. This is not a reason to go to the psych unit. But like, if they tried to like, what section me or whatever the term is, they would have no grounds to stand on because I'm not in a place where I need that, and I can self-advocate. If they did put me in one, you can bet your ass that there would be some legal ramifications, because involuntarily committing someone when they're not in a place where they believe they should be involuntarily committed, and it is a proven fact that they should not be involuntarily committed, is I believe it is in the realm of medical abuse. Like, I don't know if that's legally binding, but like, I believe that that's medical abuse, to just section someone who you refuse to listen to. I would fucking put up a fight. But anyways, yeah, it was a very tough experience for me. So I left I left the practice feeling very disheartened, feeling very angry. Maybe, and then it's like, yeah, the thing is, and I don't even think it's about weakness necessarily. It's just that I have a lot of experience with, one, mental health care. I'm gaining more experience with trans health care day by day. I know that communicating with my doctors and being honest with them about my experience is very important, but like, they, like, I believe that it's more likely that I would have been arrested than put into a psych unit by what my brain was, topics off limits. Thank you. Well, and this isn't always the type of conversation we have here. Usually I'm crocheting, we're having a good time, we're joking around, it's a great time. But mental fragility, yeah, I know you didn't mean it like that, but I just wanted to clarify, because even if you did experience like a mental break due to this, it's not on the patient to deal with that level of, I don't know, is abuse the right word? I'm not quite sure. Ignorance is definitely a word, but abuse, I'm not quite sure. I don't like to throw that word out willy-nilly, but like, it was all fucked up, right? So I have a long history of having to self-advocate, because if I didn't, my care would be very different, and I would be in a very different position in my life, which is already a dumpster fire. It would be even worse. So, if someone was newly diagnosed or some bullying, but yeah, it was so like, it was bizarre. It's beyond bizarre. It felt like mean. And I don't like, I feel like kind of childish by saying this. Thank you. I really appreciate that. But like, it felt mean. Like, and I don't know what other word to say other than that. It just felt like they were They didn't care about patients. It was just like a what's the term, like a patient farm? Is that what I'm looking for? Where they're basically just getting patients and they're just like, okay, all right, just go for this, all right, just go for that. I'm not really gonna listen to what you say because I know everything because I'm, a doctor and whatever. It felt very much like that, where it was just kind of like you're in, you're out. The doctor, like I imagine that the minute I left, literally not one person in that entire practice gave a shit about my experience, and I imagine that none of them will lose sleep over what happened to me today, but I will. And no one no one cares, and that's a very difficult situation to be in. And I do believe I agree with you, Mama G, where if people weren't in a similar place of being able to self-advocate, they would have been in a much harder position than I was in, and I was already in a very hard position. So I think that it I want to be like, hey, you fucking yes, belt mentality. Exactly. It's just like let's get patients in and out. We have a time schedule to be, on and stuff like that. We just want your insurance company to pay us. We want your money, and then you're out the door, and we won't fucking give a shit. But I've never based their care off of it. It's very possible. Um, I feel like no one. I felt what someone who is unable to speak, like maybe I can liken it to. I don't like likening things to people whose experience I don't understand, but for me, it almost felt like I was just speaking a different language than them, and they saw me speaking a different language, and they're like, "Well, this dude doesn't know what the fuck he's talking, or this girl doesn't know what they're talking about. Let's just kind of fucking do business as usual." Be a mom there. I love that. I love that. Um, but yeah, so I know that there are so many problems in healthcare that extend way beyond gender affirming care and mental health care. But it's tackling. Sometimes it's tackling one issue at a time to see if we can do better. That Yeah, and the thing is, so you know I can't make someone write me a script for something that they don't feel qualified for, and I don't want to. And, um, I'm not gonna like this person. The doctor kept on saying, "Well, I don't feel comfortable doing gender affirming care." That is fine. That is not the doctor's fault, right? They are a general practitioner and do family medicine, and that might not be something they can do, and that's feel comfortable with, and that is fine. I am okay with people practicing within the scope that they are comfortable with, but what I'm not okay with is being totally unheard and unseen in my care, in my medical and mental health care. It is not right. And also to have all these people tell me it was okay, and this provider could give me, um, gender affirming care. Also, so it wasn't just that provider in that location that didn't do gender affirming care. It was literally every provider in that practice that did not do gender affirming care. So why the fuck am I receiving so much information that this facility can help me? I know. And I told so many people why I was going. No one said it was gonna be a problem. I found out it was a problem the minute the doctor walked in and asked me why I was there. So I just have to say that I really appreciate all you being here, listening to me vent, telling me, kind of these things that yeah, what's up, Crystal? Um, but I just appreciate you all listening to me and being very sweet to me, and and just the support that I get off of people on YouTube is just frankly unmatched, like, and Mel was super supportive and was like, "I'm so sorry." Yes, yes, Crystal, that is exactly what happened. And I told multiple people, and they still took that appointment. Yep. Yeah. So with the other hospital system that they misgendered me, they didn't have a space in the uh, point of sale or whatever. Exactly. And the thing is, I want to, like, I don't know how to go about this. With the other hospital system, I recognize that there was a flaw in their system where there was no way for a provider who was coming to talk to me for the first time, a way for them to know my pronouns and my chosen name. I understand that. And so I called the helpline for that hospital system and I was like, you need to have space for this. And they're like, oh, we can put a note in your chart. And I said, that's not the problem. I was like, there is a note in my chart and no one could see it because of everything else that was going on. So you need to have a space that's at the fucking top. When I get my wristband, it should have my chosen name on there. And it would be great if it even had my pronouns on there. That would be really cool. But no, that's not what happened. So, um, it is, so I talked to them about it. But for me, I haven't experienced this type of care, this poor level of care within this other hospital system. Hey, Leather. Within this other hospital system that I went to today, because they're known for being the best gender affirming care hospital system in the area I'm in. And I'm in the Triangle area, like the Raleigh Durham. I'm not really Durham, but like Raleigh area um, of uh, of North Carolina, and there are a bunch. So we have, the University of North Carolina, UNC. We have Wake Med. We have Duke. We have someone else, but we are known for having good hospitals, because we have a bunch of teaching hospitals and stuff like that. And so this particular hospital that I went to, um, administration, local gender groups, share your horrific experience. Yeah, I was like, maybe I could put something on Yelp, but then I was like, the thing is, no one really reads Yelp. I think I don't read Yelp when I'm going to a a doctor. I just go through my I generally go through my insurance portal. So the thing about changing your name, so changing your Molly Duke. I'm not really sure. Holy moly, Duke is amazing. Yeah, so Duke is not the system that I go to, but the system I go to is actually known more for their gender affirming care, which this practice is part of that system. But Duke is great for a lot of things, but it's generally further for me. Because I kind of live on the other side of the triangle, which is this area. Um, so, uh, so yeah, so the thing is, changing your name is actually very um, weird, and I don't know if it's like this in every state. So here's the thing. So if you change your name, and to do that, you have to go through multiple steps. One of those steps is going to your local sheriff's office and getting fingerprinted and having that sent to the federal government. And I'm sorry, but that makes me feel a little icky. I will do it, but it makes me feel a little icky. So the first time you do it, you pay the fees, you do all the shit, you send in all the paperwork, you blah 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 blah. But let's say, so the thing about choosing your own name is like, Ian is not the first chosen name that I've tried. I've had Ian for a long time. I really like it. And yeah, that the fingerprint thing is fucking real. And I guess it's so you don't steal people's identities or something, but like I don't really know. Yeah, it's a lot of work to get your name changed, right? And the thing is, if I had transitioned in short around the time that I got married, I could have changed. I had like a year window where I could have changed my name for free, but I wasn't out as trans. I didn't know. But the thing is, you change your name once, you go through all of this process. But what if I decide 5 years down the road that Ian just isn't a really good fit for me? Right now, I can't see a time where Ian wouldn't be good for me. I really like it. But what if I change my mind? Well, then it's a huge process to change your name again. Huge. Like, you have to get a lawyer, you have to go to court. Like, it's all this big fucking mess to change your name again. So that's why I've kind of been holding out on legally changing my name because you know it's like if I do decide to go by a different name, it's still not going to work. Also, so my name is Ian. Half the people I meet, this blows my fucking mind. Half the people I meet, if they just see my name on a screen or something like that, half of them call me Ian. I'm like, Ian isn't even a fucking name. It's Ian. It's a very common name. But you know, and I thought I had picked a name that would be really easy to pronounce, but I guess not. And then to me, in my experience, I have never met a female or you know, uh, like femme. Yeah, it's do you have $150 that you can donate to me? Because to me, that's actually a fair amount of money. I know, I'm like, what the fuck? But they look at me, they see that I'm still looking very fairly feminine, I guess. And, you know, I am wearing my lesbian lingerie. But like, still $150 is a lot of money. And then what if I decide to change my name? So it is like, so I'm in the US, um, and um, and it's just a huge long process. And for me, the whole fingerprinting thing makes me fairly uncomfortable, for a number of reasons. Like I don't quite understand the logic behind it, other than potentially reducing identity theft. But like, I don't know. Like, it just seems like the whole system's just not made for trans folks. And name changing does happen. Like, if you just reach a point in your life where that's not a good fit for you, or what do I do if I need to change it again? I mean, anything could be more, but that doesn't mean it's affordable. Just in my experience, you know, I'm not trying to argue with you. I hope you know that, but like, yeah. And so to change your gender, so from what I understand, so there's two things, right? So one is changing your gender identity on like your license and things like that. That is more affordable, more easily accessible. I do not want to change my gender on my ID until I change my name. So it's like a step-by-step process, right? So I'm going to change my name, and then I want to change my gender marker. That's awesome. That's not the situation here. And then in some states, you are allowed to legally change your birth certificate to show your gender. Because that can be an issue. Like, let's say you're going to a place where they need a certain number of legal documents showing that you are who you are. Like, let's say you're getting a passport or something like that. So if, let's say, your birth certificate gender does not match your gender on your photo ID, then that can be an issue. So in some states, you're allowed to change your gender marker on your birth certificate to accurately reflect your gender identity. Okay, okay. I did not know that. Thank you for letting me know. I didn't know because I was just focused on name change because again, that's step one for me. But in the state of North Carolina, as far as I know, you cannot change your birth certificate gender. So that puts me in a bit of a pickle again if I need to. I think my passport is expired at this point, or it might be on its last leg. But like, if I decide to renew my passport, I'll have to do all the same documentation. And if things are incongruent there, then it will put a kink in me being able to get that documentation, further documentation, because anything that they can spot that doesn't look right, that doesn't match, they have a really hard time. So it's really like for me, it's all of that has to be done consecutively, right? Because let's say your legal name is now Ian, and your birth certificate says something different, and your gender on your birth certificate's different than your ID. All of those things, it's a mess, y'all. It's a mess. It's such a complicate. I wish they could just like roll up all of that stuff, but unfortunately they can't. And then let's say for whatever reason I did decide to detransition. What are the law? Are there different laws in that state? So I was born in South Carolina, and if North Carolina is like that, then I imagine that South Carolina is at least 3 times worse. That's just, and I'm not dissing all of South Carolina. There are parts of South Carolina I love, but they are a little bit more stuck in their ways than North Carolina in general, if I'm being honest. My opinion, take it or leave it. I love South Carolina. There's parts of North Carolina I love, but it's just, we're in the South, we're in the Bible Belt. Things are very slow moving here. Pretty much unless it becomes like a federal law, things just don't kind of happen like that, unfortunately. Needs to know your gender anyway. For what purpose? I mean, that's a great point. I think it's more so like, I think it's more so for, and this is kind of archaic in how it's done, but I believe that a lot of it is like, let's say you were crossing the border and like your gender says you're a male, but you're very female presenting, like they kind of, it just kind of keeps, I don't know, it just kind of keeps potentially anyone just from taking your ID. I don't know. Um, but would it feel better for you if there is an option in passports and IDs other than male, female? For me, yeah, I mean, I think inclusivity is very important. I know in many states, I don't believe in North Carolina, but in many states, your gender marker on your license can be X, which is basically an other category. So there are places where that is an option. And I think for a lot of people, that's very important. It's very gender affirming for them. I would like to stay out of our underwear drawer. Exactly. And guess what? Like, the underwear drawer isn't even indicative of what actually, of what gender you present as, right? Because, I know a lot of cis women who wear boxers, and I know some cis men who wear panties. Like, that's not even indicative. Your genitals aren't indicative of what you have. People need to stay out of our bedrooms, out of our underwear drawer, out of all of that stuff, because it doesn't fucking matter. That's the thing about gay marriage and all that stuff. It's like, just stay out of our bedrooms. I'm not forcing you to watch gay sex. Just like fucking let me have rights, It's like, it really is just about letting people live their lives. If they're not harming themselves or anyone else, I don't see how it's anyone's business but that person and the people that they decide to be around. I just don't get it. The thing is, like, there's all this talk about states' rights versus federal rights and all this stuff. And, I'm trying not to get too political, but I probably will get progressively more political during this election season. Unfortunately, I don't like that, but it's something that I need, some stuff that I need to say to advocate for myself further, and just kind of give people some information, and they can do whatever they want with that. I'm not trying to change people's minds. I'm just trying to provide more information so that they can make an informed decision about how they want to vote, stuff like that. But I forget where I was going. But oh yeah, conversations between state rights and federal rights, and there are some things that are voted on. Yeah, and the thing is, like, you know, there's a lot of things that are really challenging. That, like, I think there's always a balance, right? Of, like, what we let the government do and what we let people do, and there's some things that don't need to mesh. Um, I would assume the answer male female because certainly, yeah. So, like, the thing is, like, biologically, I understand that I have female biology. I'm not delusional about that, and there are some people, some trolls and stuff that are like, well, if they find your bones, they're gonna be like, you're a female. It's like, okay, well, I'll be fucking dead, so I don't give a shit what you call me. um So, okay, let me but yeah, so I think understanding the biology that that person experiences is very important. I understand in a medical setting, while that saying this person is genetically a female or genetically a male or genetically other, because we do have to be inclusive of those people who are genetically others. People who are born intersex, where they're either born with like a mishmash of both female and male genitalia and hormones. We need to make sure that that those people are taken care of. So I do understand, but there's not even an option for intersex folks, and that's a huge intersex people have just overall just been treated like garbage throughout history, and like they're literally mutilated at birth, some of them, and it's just very unfortunate. But I do understand what you're saying, Crystal, that that is an important aspect. I talk about Dr. Mike a lot because I really like his stuff on YouTube, and he was like, a lot of the studies on, like, he used, like, one example was heart attacks, and like the symptoms of of heart attacks are different in biological men and biological women, but all the studies were done on biological men. So the signs and symptoms might not present like that for a biological female. And so it's important that doctors are able to have that data so that they can be more informed about things. Yeah. Um, Yeah, so let's see. Sorry, I missed something. Let's go back. Something was said I didn't want to respond to. So Scraptastic for share. So one thing I mentioned earlier is that I feel like with trans folks, gender dysphoria is really challenging. It is a medical condition. It is not a mental health condition. It is a medical condition. Um, and I really, some people, I feel like it's very easy to not understand why someone would be so upset when they're misgendered. I understand that that might be a really far reach for some people to understand why that person would be upset. I'm not blaming cisgender people for that, because I was trying to think of any metaphor I could, and I could not think of a metaphor. And I'm the king of metaphors. I love metaphors, but I could not think of anything to relate that feeling of it not being right. I could not think of any way to describe it. And it's it should be okay for people to, like, you never know what kind of day someone's had. Maybe they've been misgendered about 100 times before you interact with them, and that one misgendering can really upset them because it was the straw that broke their back. And I think when people get upset, it's just because it's demoralizing. It is hard. And even there are some people in the trans community that that are trans men or trans women who don't understand why people get so pissed off about misgendering if you look a certain way or something like that. The thing is, gender expression, how someone looks on the outside. So let's say you see someone with a full beard, but who's wearing a dress. Um, you know, that's gender expression right there, right? But then, like, gender identity, like, I am a femme. Like, I love doing makeup. I love doing stuff with my hair. I love dressing all kinds of ways. I love wearing jewelry. But I am a man. And so it's like, I think that that's where the gender expression, what I wear, and gender identity, what I go to sleep as, what I wake up as, is really important. So I think, I know it's hard when you're doing your best and you misgender someone accidentally, and they don't, and you know, what was I saying? Sorry. Um, and they get mad at you, and you're like, shit, I'm sorry, I'm so sorry, I didn't mean to do that. And they get upset, and you're like, shit, I fucked up. But like, I understand that, and I don't want to be like critical of that, because that's a totally valid way to view things. But you just never know what someone's going through and how many times they've been misgendered that day. It feels awful. It feels like I'm really struggling with any kind of metaphor. Um, it just feels like you're being erased. Who you have fought to be is being erased. It's the best I can give you. It's not great, but that. So, sometimes people are a little bit more aggressive than others. I'm not that kind of person, but I got to be that kind of person by the end of my experience today, where I raised my voice and told people to stop misgendering me. You know, that was the straw that broke my back. I didn't start out like that, but I ended up like that. So it's really challenging to kind of. Okay, the thing is, okay, some people like really wish they were born genetically, like whatever, as the person they identify with. No one is saying that you um, you aren't that. The thing is, what's interesting is that a lot of what we are tagged as at birth has nothing to do with our chromosomes and has everything to do with the genitalia we're born with. Now, like I said earlier, with intersex folks who are born with both female and male genitalia, those people are often erased. They have surgery when they are days old, and most of the time they are never told. Sometimes the parents aren't even told that the surgery happened. They say, oh, we need to do surgery on your kid, something's wrong, and then they just do surgery on these people. So people are always like, chromosomes, 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 but literally no one has ever looked at my chromosomes. So, and then, there's so many issues that can happen with chromosomes as well. I hate the chromosome argument, because who gives a fucking flying fuck about that? But I have a kind of cousin who was born with an extra Y, I think, and he is a male, but so biologically, uh, you know, he was viewed as a male, but he has an extra chromosome. So that argument to me, I don't give a shit what you were born as, because I was born as I was born as a baby. I was born as a blonde. Like those kinds of things. It doesn't matter what we're born as. You don't give a shit about your gender identity when you're fucking 8 weeks old. But I'm out here living my life, and that shouldn't fucking matter. Yeah, exactly. Like these things don't have gender. Yeah. And so like I'm not asking for us to change our view of biology, but I am saying that there are a lot of people who fall through the cracks of current medical care that need to be considered more thoughtfully in the process. So hopefully that makes sense. And I am hearing what everyone is saying, and I really appreciate the courtesy that everyone is showing. Even if I disagree with maybe a statement you said or something like that, it's not that I think that you're a bad person for having that opinion, but maybe there's some more education we can do in certain things. So I just want to say that I appreciate all of you being here, giving me support and love, because sometimes and especially when you're mentally ill like I am, it is really difficult to know if you are overreacting in a situation. It's really difficult to dictate whether or not your perception of the yeah, like there are a ton of drag queens, and not to say that trans and drag, aren't. I mean, they are connected in a lot of ways, but they're not the same thing by any means. There's a lot of cis men who dress up however they want, a lot of cis women who dress up however they want, and you know, that's again the difference between gender expression, just the clothes you put on, the makeup you put on, the jewelry you put on, and gender identity. What do you go to sleep as? Are you a man? Are you a woman? Are you something different? All of those things are fine. So, I kind of want to end it here because I feel like we've gotten to a good place, and I feel like there is potential for us to start kind of being a little bit more nitpicky about these types of things. So I do want to stop the discussion before it potentially becomes something I don't want it to be. But I appreciate you all listening to my story. If you didn't hear the majority of my medical experience, it's in the earlier part of this thing. Yeah, that's awesome. Yeah, I mean, and people with extra chromosomes like deserve love, and unfortunately, this genetic mutation that my cousin has, those people are more prone to violence, and a lot of them end up in jail because they just don't have the awareness, the cognitive awareness to know right from wrong, and this person that I'm related to doesn't necessarily have that, so it's a little challenging. Well, it's pretty challenging. But that's why people, when they bring up the chromosome argument, for me, it's like, have you checked yours? Do you know yours for a fact? Because you might have something extra floating around in there. You don't know. You don't know if you were, like, maybe you were born intersex, and the doctor did not tell you or your parents. That happens a lot. I think the statistics on intersex folks, so if you don't know the term intersex, the prior term, which is no longer, I believe, politically correct, is like hermaphrodite or hermaphroditic. Let me see. Intersex prevalence rates. It's more common than you think. So, the most thorough, this is just the first thing that shows up. So the most thorough existing research finds intersex people to constitute an estimated 1.7% of the population, which makes being intersex about as common as having red hair. Like, that's pretty surprising, right? Yeah, so just information, right? Information helps us grow, helps us learn, helps us shift our ideas, and things, our knowledge about the world. So I always want to be a source for education, and you all educate me and teach me things all the time, which I really do appreciate, because I don't know everything. I'm kind of glad I don't know everything, because I do have a passion for learning and wanting to be better and wanting to understand situations better. So thank you so much for listening. I really appreciate it. You all are great friends to me. Yeah, I thought it was maybe 1 in 100, but it's closer to 2 in 100, 1 in 50. So yeah, it's actually fairly common. And a lot of people don't know that. A lot of people don't even know these people exist. They think it's like a myth. But yes, so thank you for listening. I really appreciate it, and I hope you all have a great day. And I will talk to you later. Thank you. I really, really, really appreciate it, sincerely, from the bottom of my heart. Thank you, and I'll talk to you later.